Hi there, I'm Mick Fennick. I'm the D&V coordinator at High Tunstall in Hartlepool and an ITC first aid trainer. I'm going to take you through the accident procedure today. That's an important part of the Duke of Edinburgh Bronze, Silver and Gold Award framework, and the accident procedure will give you a basic understanding of the routine that you need to follow if you have to deal with a casualty inside or out. So we're going to assess for danger. I'm looking around the casualty to see if there's anything that could cause a danger to me, because if I step in and it's dangerous, I could end up being a casualty as well. I've assessed, I can't see anything that is a problem, but I'm also, as I'm assessing, going to consider whether I need to put on any personal protective equipment to stop any risk of cross-contamination. Is AVPU. So first of all, I'm trying to see if the casualty looks alert. Obviously in this situation the casualty isn't looking alert. If they were sat up around moving or talking, then that would be a sign that at least we could have a conversation and assess what the problem was. So secondly, I'm going to use my voice. I'm going to use that to assess again his response to see if he can hear me. I'm also going to use it to try and reassure him. So hello, my name's Mick, can you hear me? I'm here to help. I'm just going to give your shoulders a quick squeeze now, just to see if there's any response, and there's no response to the pressure that I've exerted there. It's at this point that I need to shout for help. Next we're going to move on to checking the airway. I'm just going to have a quick check to see if there's any signs of any obstruction. There's nothing there. I'm now going to perform a chin lift. So using my thumb and forefinger, I'm going to take hold of the casualty's chin. I'm going to place the other hand on their forehead and I'm going to tip the head back to open up the airway. This removes the tongue as an obstruction from the back of the throat and allows the casualty the best possible position to breathe. Okay, I'm not going to check for the casualty's breathing. I'm going to be checking for up to 10 seconds, trying to see if I can feel the breath on the side of my face as I do so, and looking down the casualty's body to see if I can see any signs of breathing or any movement from the stomach. So, keeping the head in that safe airway position, I'm going to check, see if I can see any signs of any breathing. At the moment the casualty is breathing, still unresponsive. I now want to do a quick check to see if there's any signs of any bleeding or any problems with the circulation. So I'm going to do a very quick check down the body just to see if there's any signs of any bleeding. I'm going to check underneath the legs and the back to see if I can feel any blood pooling at all. And there's no obvious signs of any bleeding with the casualty. This video is intended to give an overview of the accident procedure and does not go into detail about the recovery position and CPR. These will appear in subsequent videos. To recap, the accident procedure is to firstly check for danger, minimising any environmental danger and making sure that you're prepared for any cross-infection dangers. Consider the possible history, i.e. the mechanism of injury or the possibility of illness as you approach the casualty, and then to check for a response. You're doing this by checking to see if the casualty is alert, if they respond to voice, and if they then fail to do that, if they respond to slight pressure, a tap on the shoulders or a gentle squeeze of the shoulders. If none of those are apparent, then you need to shout for help. The next step is to open the airway by tilting the head and lifting the chin. Then you will be assessing for breathing for up to 10 seconds. You will look, listen and feel for breathing and maintain the open airway as you do so. If breathing is absent, you would need to begin CPR. It's important to consider the chain of survival at this point, as early access to the casualty is required, and a defibrillator is a most likely piece of equipment that's going to help to restart that heart. If breathing is present, we can assume a heartbeat, and therefore we would begin to look for any serious bleeding by checking down the body to see if there are any signs of bleeding on clothing, and also if the casualty was outdoors and wearing waterproof clothing, we would check to see if there are any signs of blood pooling within that clothing.